The CBT sequence. This is a summary of my notes from CBT in Action, a Practitioner's Toolkit, Chapter 6. So I'll just talk about these steps in how cognitive behavioral therapy takes place. Number 1 is to identify the activating event. This is called A, or the situation. And basically, we want to see how an event or behavior leads to negative feelings that come about. Step 2 is to identify the consequence. That is the C, which is the feeling. Clients may be socialized to not be in touch with their feelings, or they just might not be aware about their feelings. As a result, it is encouraged to explore these further and to elaborate through words that describe and label emotions, which is really important in this specific step. Clients may experience multiple emotions at the same time. It is important to identify one emotion in one situation to make the approach seem easier. Step 3 is to explore the consequence further. This helps to evaluate how clients are feeling about the feelings. So you can use subjective units of distress scales, or SUDS. Well, according to Wolpe, 1969, he stated that therapists should ask clients to indicate levels of distress from 0 to 10, which is from no distress to extremely distress. This helps to quantify the subjective measure. Next, therapists should ask clients about the behaviors they engage in when this certain emotion comes about. For example, what did they do when the client felt a certain emotion? Afterwards, therapists should ask what physical sensations accompany the emotions. This helps to bypass the issue of culture and understand if the patient is accurate in expressing their emotions. The issue of culture being, as stated before, maybe they're not socialized or that they're conditioned to not be in tune with their feelings. So step 4 is to evaluate the presence of secondary emotions. These include situations where individuals have an adverse reaction to how they feel. It involves meta-emotion and reflecting upon a primary emotion. This would then turn the primary emotion into A, which is the situation, that causes one to react in a certain way, B, and thus as a consequence producing the secondary emotion. These secondary emotions may block individuals from addressing their primary emotions. A good indicator of an individual blocking their emotions is when they lack that logical connection between cognition and emotion. Therapists need only to ask about how they are feeling about their feelings in order to get around this issue. So step 5 then is to elicit the beliefs and thoughts. B are the beliefs and thoughts, and thus in doing so, it helps to identify the unhelpful beliefs, cognitions, and expectations that lead to C, or the consequence. It is important to have specific, concrete activating events which can help elicit the beliefs, and therapists can use this to further explore and point out clients' beliefs. Other ways to help elicit these is through role play or by the eliciting of certain phrases. There's a thing called Socratic questioning, which was made by Socrates, of course, and is employed rather than outright telling clients directly about the exploring cognitions. So, for example, the therapist asks, "What are you thinking?" to explore inferences or thoughts. "What do you expect?" to explore rules or demands. And "what does that mean to you?" to explore core beliefs and evaluations, as opposed to just saying outright, "What are your thoughts?" As in, like, what inferences do you have, or what rules are you setting, or what evaluations are you making? These are more subtle ways of trying to ask the same thing, really. Back in 1995, identified 3 types of cognitions, and that these were structured in a more complex hierarchy. The first level, you could say, is automatic thoughts. These include initial cognitions that come into one's mind. Second are the intermediate beliefs, which are assumptions and rules that individuals use to perceive the world. The third kind of cognition are the core evaluations, beliefs, or schemas. these are the beliefs about the self or beliefs about the world, which are very fundamental to the individual. You could say that it is kind of at the heart of how they perceive everything else to be around them. So for example, the individual might think, oh, I am hopeless or helpless. Then that is their core belief. And that these more complex hierarchy of cognitions would then have an influence on the simpler, less complex cognitions, like the intermediate beliefs and automatic thoughts. So in a way, there's like a kind of top-down as well as a bottom-up sort of interaction. Ellis, in 1962 and 1994, identified 3 types of cognitions, and that these 2 also were structured from simple to more complex in a hierarchy. So the first type are inferences, in that individuals have a certain interpretation of events, which are in specific situations. These then lead to demands, where individuals would have demands on themselves or others, and eventually these lead to evaluations, which are more globalizing, or it could be, for example, like negative ratings of the self or others. To elaborate regarding demands, they are not necessarily the source of negative evaluation, but it could be due to like the inability to meet them, and then thus causing unwarranted dissonance or dissatisfaction or some kind of negativity or disturbance upon one's psyche. That's according to O'Kelly and colleagues. As a result, this can lead to awfulizing, catastrophizing, a low frustration tolerance, globalizing negative beliefs, etc., according to Ellis again. He emphasized that one should work to challenge their demands and evaluations. Step 6 in cognitive behavioral therapy is to make the B-C connection. This involves helping patients understand and accept that their beliefs lead to feelings, and that it involves the patients in taking emotional responsibility in order for change to occur. So there are various approaches that can be taken. There is the direct approach, where the therapist can point out the elicited thoughts, beliefs, and feelings, and quite literally state that their thinking and not the situation is causing them to feel the way they do. There is the intrapersonal approach, where the therapist compares times when patients feel differently about certain situations. And this helps the patients to see that it was due to different thoughts. There's the interpersonal approach, where therapists ask patients if they believe everyone would feel the same way in a reaction to a situation. So kind of taking the focus away from the patient and then globalizing it to how others would react. Another approach is to ask, what if it were me? This helps the clients to understand the BC connection from an objective perspective. As stating before, like you would ask how the others would perceive you if this certain thing happened. Thus, in doing so, to help reduce the person's negative inferences, thoughts, beliefs about reacting a certain way in a certain situation. You could use stick figures or thought or heart bubbles to show the BC connection as well. So yeah, those are the steps of cognitive behavioral therapy. But at the heart of it, it is finding out the event, which is A, looking at the beliefs and thoughts that interpret the event, that's B, and then the C is the consequences. It could be feelings that you feel as a result of it, or the behaviors, or bad consequences, bad actions that come about as a result of this negative thought. But the premise is the thought or belief that mediates between the situation and the outcome. Please let me know if you have any questions in the comments below. Thank you very much. Bye.